Postural tachycardia syndrome is a condition which has been recently described in the medical literature, perhaps over the last 25 years, but actually the first reports of this condition were as long ago as 150 years when physicians recorded a condition of irritable heart syndrome. The term postural tachycardia syndrome is rather complex and medically confusing. What it refers to in lay terms is elevated heart rate when changing posture, and particularly when becoming upright from a seated or lying position. Now, the important thing here is that there is a formal definition of the condition which requires the heart rate to be raised either above 120 beats per minute or by more than 30 beats per minute from the resting heart rate, and that this needs to happen within 10 minutes of standing, and also this needs to be sustained. Importantly, with this condition, blood pressure changes are not supposed to be observed and do not form part of the diagnosis. However, the patients will often complain of symptoms of feeling dizzy or lightheaded, suggesting perhaps that the blood pressure has gone down when in fact it is not supposed to have. The kind of person that most commonly seems to experience symptoms of POTS or postural tachycardia syndrome are women of childbearing age and premenopausal. The funny thing here is that you're much more likely to have POTS if you're a young woman, perhaps four or five times more likely than your male equivalent. The thing here is that there are men that have the symptom of POTS, but we don't see them as much in the clinic, and perhaps the females are overrepresented to an extent because they can often have quite debilitating symptoms related to the condition. This makes it quite challenging to look after them, but nonetheless we have to try and find ways in which we can both diagnose this condition and help to treat the patients whilst being sympathetic to their needs. The symptoms of the postural tachycardia syndrome are varied and reflect the complexity of the medical condition that it represents. For instance, when one thinks of POTS or postural tachycardia syndrome, one has to imagine that the patient can have involvement of the heart and the circulation. They can have involvement of the gut, they can have involvement of the bladder. Underlying this may be a tendency to joint hypermobility syndrome, as well as having significant cognitive and behavioral issues. Starting with the circulation, patients most commonly will complain of dizziness, although out-and-out fainting is not that common. Perhaps less than 30% of patients will experience what we call syncope or faints. In a number of patients, change in posture results in dizziness, either when getting up from lying or when arising from seated. The thing here is that we're not supposed to be diagnosing blood pressure change at the same time as the dizziness, and this can often lead other practitioners to somewhat be skeptical about the patient's complaint, as they cannot find a reason for the symptoms of dizziness. The other predominant cardiac symptom that these patients complain about is of heart rate elevation or palpitations. This can sometimes be quite anxiety-provoking for understandable reasons. Sometimes the heart rates can go exceedingly high indeed in the absence of any other provocation, and this can cause distress for a number of the patients. Other symptoms that can arise in the postural tachycardia syndrome relate to the gut and involve features of irritable bowel syndrome, including bloating, constipation, tummy pain, sometimes change in bowel habit as well. All in all, these symptoms can also be quite distressing for a number of our patients, and they do require specialized input to help with the management. One of the most important aspects of POTS that is only getting recognition in the recent times is that of the psychological disturbances that can arise with this condition. What we have come to recognize is increasing symptoms of anxiety and depression in patients with POTS. In addition to this, they can also complain of problems with attention, memory, and executive function, i.e. their ability to complete tasks. At present, it is not known the best approach to manage these sorts of symptoms, although one would think that a psychologist or psychotherapist might be the appropriate person to help out in this instance. The other aspect of POTS that requires medical input due to symptoms is of the hypermobility spectrum disorders, which often accompany this disorder. This can result in patients having issues with joint aches and pains or even joint dislocations, tendency to spraining of ligaments, a tendency to easy bruising, and a tendency to scars that heal poorly. All in all, these are best managed by rheumatologists. The most common way for people to present with POTS, either men or women, is with the heart rate disturbances that come with this condition. This involves symptoms of unexpected palpitations or dizziness and a tendency to feeling very lightheaded when changing posture. At this point in time, the physician may be somewhat confused by the presentation of the patient because the heart rate elevation is unexpected and there is no blood pressure change when the patient complains of dizziness. However, these to me are hallmarks of the postural tachycardia syndrome, and at this point probably the patient is best off seeking specialist input. The very important thing to realize is that there is no one specialist that is able to manage all the aspects of POTS, which we are increasingly recognizing to be a complex multi-system disorder. Having said that, that is not a cause to despair because there are specialists around who have interest in this condition and have the competency to be able to help patients with these complaints. All in all, the most important thing is to identify clinicians who are regularly seeing patients with the postural tachycardia syndrome and who have established good networks of care that involve good communication between the physicians and the patients so that a holistic approach can be taken to help with patient care and to support the patient in what is often a very challenging clinical environment. The treatment for postural tachycardia syndrome really depends on what the patient's principal complaint is. If we focus on the cardiovascular system, which is my area of expertise, then we would be talking about how to manage palpitations, which is rapid heart rate, or dizziness, which is the tendency to feel almost like fainting or actually going on to having a frank faint. With the symptoms of rapid heart rate and dizziness, there are drug treatments to manage the patients, but the first instance we always try and use non-pharmacological or non-drug treatments. This would consist of supporting the circulation with increased salt and fluid intake, avoiding dehydration, avoiding excessive hot weather. We would also recommend avoidance of caffeinated products, and usually alcohol is not well tolerated by these patients. Other physical maneuvers that patients can undertake to avoid dizziness and palpitations include being careful about change in posture, for instance getting up slowly from a seated position and avoiding running upstairs. Patients with POTS often don't tolerate being stood up for a long time in any one place, and we would advise them that if they're queuing somewhere to be marching on the spot or to use rapid leg alternating movements or even stooping to prevent the fluid accumulating in the lower limbs. Other treatments that we recommend for patients to avoid dizziness and palpitations include use of compression hosiery. This involves compression stockings to the legs, usually in the form of lower limb grade 2 graduated compression stockings that are thigh length, because ones that are below the knee are no good. Furthermore, some of our patients require abdominal compression garments such as corsets or binders, which can also help to prevent dizziness. When one talks about drug treatment of POTS, there are only a few options, and the key thing here is that the treatments are tolerated well by the patients, which drugs are not always the case. So we use drugs such as ivabradine or beta blockers to keep the heart rate under control, but by and large I try and minimize the use of medication where possible in this patient group.